Okay, thank you. Of course, this is a board discussion item. It's to consider a resolution supporting efforts and policies to assist those dealing with drug and opioid abuse addiction. And we have our Director of Public and Governmental Affairs, Mr. Gary Schmidt, to lead off, and I understand we may have other presenters as well.
Yes, Commissioners, as you know, an opioid epidemic is ravaging communities across the United States and right here in Clackamas County. As a commission, you have previously committed to curb drug and opioid abuse within the county and expand treatment and recovery options for people in need. Commissioner Fisher brought forward this resolution to you at an issue session on June 19th, and you agreed to bring it forward today for discussion and approval. And Commissioner Fisher originally got the idea from Milwaukee City Councilor Wilda Parks, who championed a similar resolution with the City of Milwaukee. So I would ask her, who she's here today, if Councilor Parks would please come forward, as well as the from the Milwaukee Police Department, Captain Luke Strait, to give some comments on what they did at the City of Milwaukee, which is spurring why we're here today.
Thank you for joining us.
Thanks for inviting us to be here today. I want to kind of take your minds back to a Friday the 13th. Yeah, it was actually a Friday the 13th. You know, no bad luck in those kind of days, though, because amongst others, Commissioner Fisher and I had the opportunity to be at the first ever Tri-County Opioid Seminar. Now, that sounds like, oh, what were they doing? You know, right. Well, it was a gathering that included commissioners from Multnomah, Washington, and Clackamas County, district attorneys, sheriffs, chiefs of police, staff from county and health and human services, nonprofit substance abuse treatment providers, hospital systems, and others, including a very few city councilors from throughout the Tri-County region. Our Milwaukee Police Chief, Steve Bartol, and I were there to join in a regional discussion about opioid abuse, understand the issues, and seek common agreement on ways to assist those in addiction to obtain access to quality, affordable services. With an estimated 64,000 people in the U.S. dying each year from overdoses, this is a nationwide epidemic. And in some way, it touches every single one of us. As you think about it, just realize that. Every one of us in some way, some more so than others, but we're all touched by the opioid abuse and the epidemic that's going on. And last year, just in the metro region, 180 people lost their lives as a result of opioid abuse. The presentations that day around treatment, overdosing, housing, medication, chronic disease, all led to several public policy suggestions that our chief and I thought the City of Milwaukee could support. On Tuesday, May 1st, Milwaukee City Council, on a 5-0 vote, adopted a resolution to support these types of policies, which you'll hear about in a moment. And as we did that, each of us took a minute to speak to what this meant to them. And the five of us, it was interesting to see, as I'd said earlier, that each one of us in some way or another was touched, in whether it be in a magnitude or a minuscule way, or somebody they knew, or somebody in their family, or something that had happened, even a burglary that had occurred because someone was seeking the opportunity for money to buy that. So I applaud the Board of County Commissioners today for doing the same as Milwaukee did. I hope the steps toward finding solutions will be embraced by other cities and other counties in the state of Oregon and hopefully throughout the United States. Thank you. Captain?
First of all, thanks for having us, and it's an honor to accompany Councilor Parks here and speak with you folks about this. As law enforcement, we recognize that traditionally in the past we've dealt with this problem through reactive criminal enforcement, which is how we deal with most of these problems in law enforcement. And we feel that it's very important, obviously at this point, to take a step back, reevaluate the situation, and be a part of the conversation that recognizes that the criminal enforcement aspect of this is not going to be a solution. That can solve individual problems temporarily if we have crimes. But we don't claim that that is going to offer any kind of a long-term solution. We would like to recognize and be a part of the conversation that involves education, early intervention, and other treatment options as more realistic solutions for this problem. As Councillor Parks said, I think we've all probably been touched by this personally, whether it's by somebody that we know or a family member or a friend of a friend. I think most of us can think of a personal situation that involves someone who's been personally affected by this crisis. And within law enforcement, obviously we're dealing with it literally every day. It's a significant part of the issues that we deal with day in and day out. One of the most memorable and touching instances involved a Milwaukee high school student who was not yet 18. She had a addiction and had dealt with law enforcement and been placed in treatment. And she got out of treatment, and on Mother's Day, she was home for the weekend, and she actually overdosed in her family's home and was found in the morning. She was in a coma for months and ultimately did come out of the coma and made a partial recovery. But just dealing with that on a weekend, on a Mother's Day, and seeing the impact to the family and listening to what they had done along the way to prevent that gives a much different perspective on what the problem is and what potential solutions we have to look at. So as law enforcement, we definitely want to be a proactive part of that conversation and reevaluate the options that could offer a more holistic approach to this than just criminal enforcement. Thank you.
Thank you, Luke.
Thank you.
Thank you, Councillor Parks and Captain Straight. Here at Clackamas County, the Clackamas County Sheriff's Office and Community Corrections Department support the Corrections Substance Abuse Program, or CSAP. This innovative program helps people who are addicted to drugs and end up in the criminal justice system. It gives them the opportunity to receive important treatment to begin a new life of sobriety. There is a young man who is currently attending CSAP named Nico Antipin, and he is here today. He has a powerful story, and very briefly he will share that with you. So Nico, if you'll please come forward.
Thank you. Welcome. Appreciate you coming today. Give us your name and the area you live.
My name is Nicholas Antipin, and I live in Oregon City. So my addiction started off young, but before that, I was a good student. I had a loving family that supported me in every way and encouraged me to get a private Christian education and instilled in me morals that would normally you would think keep me from living a lifestyle of addiction. However, when I entered high school, I wasn't safe from the influence of others and all of that. I began to use marijuana, drink with friends, and it very quickly escalated. By the age of 16, I went on to using other substances and was soon using heroin at the age of 17. I tried to stop several times. I sent myself away to a military school, lasted there for 6 months, and then as soon as I came back, I was right back in the mix of the same crowd and went right back to the use. I lost all value for myself. I knew that I was capable of being successful, but I didn't know how. The physical pain that I had from the withdrawals and the mental inability to just be alone with myself without something to leave, something to escape the guilt and shame of what I had put my family through. I went to jail several times, over a dozen. I had a lot of interactions with law enforcement, and not all of them very positive. There was one instance, though, that stopped my heroin use. It was a man overdosed in my family's house, and I had a warrant at the time, and so I tried to resuscitate the man, When police came, I left. And they were looking for me to get a statement from me. And by the time they found me, I was down the road, and they brought me into the station, and they talked to me for over an hour. And this was the first time that a law enforcement officer spoke to me the way that this man did. He was in the interagency task force, and he dealt with overdoses all the time. And he told me, you know, you're young. Why are you putting your family through this? You're capable of more. And I heard this from other people, but never from somebody who had a position of power over me. And he put it in perspective for me of all the people that he sees pass away, and he doesn't want to show up to a call to where he's going to have to see my mom crying over my dead body. And I never touched heroin from that day on. I went to jail, and before jail was a welcome reprieve, but I knew that as soon as I was out, I was going to use again. After this one interaction, that wasn't the case. I didn't know how to stay sober, though, and I still was met with that same challenge of dealing with all this anger and this guilt that I had towards myself. And luckily, I was sent to CSAP, the Correction Substance Abuse Program. That program built a support group for me of people that I can talk to about things that I never would share with my own family. They understand. They're also addicts that have gone through the same things that I have. And it changed my life. I'm now pursuing a degree in Clackamas Community College, and I have a job, and my family's proud of me again. And I see the way that my mom and my father look at me, and that they have faith in me once again, and I'm able to have faith in myself. It's an honor to speak in front of you, and thank you for the opportunity.
Well, thank you, and I often go to the graduations of our CSAP program. It's a great program that started here in Clackamas County, and very proud of it and proud of you. I mean, I was raised in a Christian family too, and I think my parents might have threatened military school once or twice. But you know, you should be very proud of yourself. You look like you're headed for absolute success, and it's really all up to you in the end, that you set your goals high and achieve them, but you'll make it.
Thank you.
Be strong and focused. Paul?
Yeah, I just want to say it takes a lot of courage to come up here and tell your story. And one way maybe to take advantage of your situation is to maybe help others, you know, and help others guide, you know, people your own age and so forth, to be an example of success, you know, that you can overcome that addiction. It doesn't always work for everyone, but, you know, for every other person you touch and you save, and you being here today and people watching this will help influence others. So just take a lot of pride in that, and wish you the best.
Absolutely. Thank you very much.
Congratulations.
Ken?
Sometimes a lot of people wonder why we invest the money that we invest in the various and sundry social service programs that we invest in. But I spent a career as a probation officer working with folks that had some of the same kind of problems. And you're a perfect example of why we make that investment. So thank you very much for coming here. I will tell you this, I was not threatened with a military school. I had a Marine Corps father, so it was about the same thing. But congratulations.
Thank you very much.
Appreciate it.
All right.
Are you going to read the
Thank
resolution?
you, Nico. So I'm going to read the resolution now for you commissioners. In the matter of supporting efforts and policies to assist those dealing with opioid abuse and addiction, whereas an unprecedented drug abuse and opioid epidemic is ravaging communities across the United States, with an estimated 64,000 people dying in 2016 from drug overdoses, nearly double the amount from a decade earlier, and whereas Clackamas County's opioid prescribing rates are the highest in the Portland region and above the state average, and whereas in 2015, pharmacies dispensed more than 417,000 opioid prescriptions in Clackamas County, which is more than the 401,000 residents of Clackamas County. And whereas Clackamas County has joined Multnomah and Lane counties in a lawsuit against opioid manufacturers, alleging they maximize profits by waging a campaign of falsehoods to addict chronic pain patients to opioids. And whereas states and communities across the nation are overwhelmed by the current epidemic of opioid abuse and addiction and are struggling to respond to and ameliorate the problem. And whereas addiction should be treated as a chronic illness rather than a criminal act, removing the negative stigma and opening the doors for treatment and recovery. And whereas the most important factors to support recovery include safe housing, stable employment, and peer support services. And whereas millions of patients suffering from addiction are unable to access the care they need due to a lack of treatment providers, funding, and options, including medication-assisted treatment and inpatient services. Now, therefore, the Clackamas County Board of Commissioners resolves as follows: to support and implement policies and practices that prevent opioid addiction and to assist those with addiction in obtaining access to quality, affordable services, and will support policies that focus on education and prevention of opioid misuse and abuse, expand and fund treatment and recovery options through federal and state funding, encourage collaboration among officials and institutions representing public health, behavioral health, public safety, education, and healthcare, reduce risks to patients by making pain treatment safer and more accessible, emphasizing the use of non-opioid treatments for pain, ensure timely access to behavioral health interventions, and enforce mental health parity laws, support safe disposal of unused or expired prescription opioids, support harm reduction through access to syringe exchange services and distribution of naloxone to those most at risk of overdose, and encourage and support innovative public safety approaches such as the Behavioral Health Unit, Law Enforcement Assisted Diversion, and Community Paramedics. Commissioners, I respectfully recommend you approve this resolution.
Commissioner Fisher.
Thank you, Gary. I so appreciate you reading the resolution. And I just want to give a special thank you to Nico. You made a comment when we were at the summit about how strong your addiction was and that it was stronger than, and you knowing that it could take your life, but the addiction was stronger than your ability to balance those challenges. And that really impacted me while I was sitting there listening to you testifying. And the piece that I see that is so critical, and I think Nico is here today to share his story because he was able to get into a treatment program that met all of the needs as far as providing the medical assistance and the cognitive behavioral therapy. We have a system now where people may be at a moment where they are ready to make that change, but we don't have the infrastructure and the support and the services. We don't have the treatment facilities. So these issues are beyond our commission. They are statewide and they are national, and we as commissioners that set the policy also need to be the advocates with all of our partners at the state and federal level to resolve this. And so I so appreciate the commitment from all of us and really appreciate Wilda for taking the lead and bringing it to Milwaukee, which gave us the idea. And thank you to the chief for all of your insight. And with that, with the captain, thank you for the correction. And with that, I would like to make a motion.
Please.
I move we approve the resolution supporting efforts and policies to assist those dealing with drug and opiate abuse addiction.
Second.
It's been moved and seconded that we approve a resolution supporting efforts and policies to assist those dealing with drug and opioid addiction. Any further discussion? I'd like to add one thing, and that is that oftentimes you have to go to jail before you get help. And we got to figure out a way we can help people before they get involved in law enforcement and having to go to jail a number of times before you actually get help. And that's where our efforts need to be made. And with that, any further discussion? All those in favor say aye.
Aye.
Aye. Opposed? Hearing none, motion carries. Thank you very much, Gary, and thank you.